Hello there, and welcome to today's interview that we're having in honor of National Women's Health and Fitness Day on September 24th. This day was initially established in 2002 to promote physical fitness and health awareness among women of all ages. I'm joined today by Dr. Jasmin Hundal, one of our editorial board members, who is a Hematology Oncology Fellow at the Cleveland Clinic, and she'll be delving into this topic with us today. Jasmin, always great to have you on the show.
Yeah, thank you for inviting me, and I look forward to discussing this important topic.
Absolutely. To start off, like, tell us, how do you focus on women's health and fitness in your work and your research?
Yeah, so that's actually a very specific focus of mine. In my research and clinical practice, I really look at how lifestyle factors, especially like exercise and nutrition, affect like the breast cancer risk, treatment, and the survivorship. Not just breast cancer, but I feel like also it doesn't matter like tumor agnostic because I feel like lifestyle factors play such an important role, and especially for our patients from a day-to-day perspective as well. But I'll focus a little bit on breast cancer since that's what I'm interested in. So breast cancer is like the most common cancer, as you know, in a woman worldwide, and the treatment, while effective, often leaves with our patients with like fatigue. Some of them can lead to cardiotoxicity, some of them can lead with neuropathy, as well as other cognitive changes and also psychological distress. So what excites me is that exercise isn't just about feeling better. We now have strong evidence that physical exercise can actually reduce the incidence, recurrence, and mortality as well. And I feel like my work focuses on making exercise prescriptions more personalized, understanding the molecular pathways behind these benefits. And lately, I've been really excited about how I can utilize digital health tools to help women maintain activity even during treatment.
Amazing. Those are all such fascinating avenues to research.
Yeah, definitely.
So, how exactly, what are some of the known ways that fitness, physical activity, nutrition impact both cancer risk reduction as well as
Mhm.
treatment and survivorship for women with breast cancer?
Yeah, that is a great question. And we know from like large meta-analyses and retrospective reviews that women who are physically active before or after diagnosis, specifically in breast cancer, because those were that cancer is like the most studied in relation to that, have significantly lower risk of recurrence and death. For example, one analysis showed that women with higher post-diagnosis activity had 30% lower breast cancer mortality, and mechanistically, it makes sense because we do know that exercise regulates hormones like estrogen and insulin, reduces the chronic inflammation and oxidative stress, and even changes in DNA methylation, which is really exciting because we do know that patients who undergo chemotherapy and immunotherapy do demonstrate, aging process. So the ability of exercise actually working on that process is very fascinating. And also the reason like there's a phase 3 clinical trial, like the Success Seed trial, where a woman with breast cancer showed a significant weight reduction in the exercise intervention arm, which led to positive, impact as well. And just lastly, in the ASCO, right, this year, the challenge trial was presented, which demonstrated 3 year structured exercise program after the diagnosis of colon cancer really improved disease-free survival and overall survival. So more studies are definitely needed in order to look at, and then ongoing studies like the Be Well Lives and Interval study are ongoing to look how weight and exercise extend survival across like breast and prostate cancer. And last but not least, like in addition to exercise, nutrition works hand in hand, so we do know that healthy dietary patterns, while we do not know a specific diet, we just know a whole, based diet, minimize processed foods, minimizing red meats, definitely has positive impact as well.
Absolutely, and I agree with the challenge trial. We've been covering that a lot, and it's really fascinating to see the results that exercise had.
Mm-hmm. Yeah.
Awesome. So of course, it's obviously very easy to say, eat healthy and be active. What are some of the barriers that women face when it comes to incorporating these things, and how do you counsel patients about how they can make it easier?
Yeah, I think barriers, that is the one reason that I feel like that patients are unable to adhere to it because of the barriers. So especially women, we have competing demands, career, family, caregiving responsibilities of children or aging parents and household roles. And plus above on that, adding like the side effects of treatment, right, as well as the time, it all creates a barrier. And then financial barriers also limit the access to like safe spaces sometimes, and also cultural expectations also play a role. So what's important is I feel like is definitely studying implementation projects, like how can we implement like exercise prescription in our clinical practice and what is more feasible, and rather than just having a generic prescription of 150 minutes per week, we need to know, like, have it more personalized. What's important in meeting is meeting women where they are. Sometimes if you just talk to them, once they describe their day, maybe it's just adding a 10-minute walk after breakfast, lunch, dinner, or whether it be a structured exercise program. I feel like every person will differ because every person will have a different barrier in their lives. But I feel like we all can spare 10 minutes here and there throughout the day.
Definitely. It's a great idea to personalize in that way and definitely meet people where they are.
Mhm.
Awesome. So when talking with your patients, how do you integrate conversations around exercise and fitness? And do you have any advice for other professionals?
Yeah. So what I try to do is normalizing exercise and this discussion as part of the cancer care. I do not focus on like the weight component or anything like that because we do know that exercise actually also improves the quality of life, the symptoms and everything like that. So I will definitely personalize my communication or my communication basically with the patient or recommendations according to what they are experiencing. So if they are, there might be some patients who want to lose weight. Other patients are there who want to, like, get their improve on their fatigue, being able to have more activity, being able to have more joint flexibility. So I really personalize it on that. And I really do not make it sound that exercise is going to be an extra. We make it as a part of the treatment. And then first, again, as I said, you meet where the patients are, you ask them what they're currently doing, and then you add small steps, and then always following up is really important. And I feel like if you don't discuss it, or if you rely on the patient bringing it up, that is a lost moment. So it's very important that we do discuss and bring this up during our visit with our patients, because if we don't bring it up, then the patient might not bring it up, or the patient might not even know that exercise is so important. So I really share that how exercise directly reduces like sleep, improve sleep, fatigue, and also can handle like chemotherapy better as well. So framing it in a way that improves your life is really important.
Absolutely. That's a great point to focus on the quality of life improvements there.
Yeah.
So you mentioned some of the recent studies like the challenge trial or other ongoing studies about exercise. Any other studies in women's health and fitness you'd like to spotlight, or maybe some of your own research you'd like to share?
Yeah, I feel like there are a lot of, like, even in the ovarian cancer space, there are some research going on. The NICTO consortium is one that is performing several clinical trials, either in the geriatric and the older woman population or in the ovarian cancer population space that is looking at exercise intervention. So that's really cool and exciting to see. Then there are also clinical trials that are looking at pre-rehabilitation, which means like for giving exercise intervention, nutrition interventions during the neoadjuvant treatment. So that those are very exciting to me. As well as I mentioned to you earlier with the aging, right? As we know, there's this longevity buzz. So in our patients, right, we do know that exercise influences like molecular markers like the DNA methylation. So that is also something that I'm excited to further delve into, and hopefully in my being able to use that as well in my future work.
Amazing. Awesome. And turning over to you a little bit, how do you personally prioritize wellness in your own career? And what advice do you have for other women with juggling health and work?
Yeah, definitely. So for me, like movement is, as was alluding earlier, is like a non-negotiable. Like, you know what I mean? For me, it's really important. So I really try to, put in like pockets of exercise, whether it be walking, and try to work out in the morning before, like, because at the end of the day, you never know what will happen. So like, I feel like I go to the gym like right in the morning before clinic. So that has been working out for me for years during medical school as well. So I try to stick to it. And then, really intentional movement every day, like even 10 minutes, like, if whether it be lunch, breakfast, dinner, like after eating, like that adds up, and then that adds up to your a total step count as well.
Mhm. Awesome. I like that. Just adding it in wherever you can.
Exactly.
Great. So as I wrap up today, in honor of National Women's Health and Fitness Day, any message you'd like to leave with both fellow healthcare providers and women in general about the importance of prioritizing wellness?
Yeah, definitely. I think movement is key, and that is definitely a very important thing that we need to incorporate as women. It is also important that we, don't follow just a buzz or just like, a diet or an exercise fad like here and there with social media. It's really easy, you know what I mean? There's this trend with like the incline trend on the treadmill, like, with the 30 minutes, like with an incline of 3. But whatever you choose to do, just try to stick to it because that is what matters most. So whatever you choose whatever kind of workout, whatever kind of exercise intervention you're trying to use. Just please try to stick to it because I think that is the most important part, like the adherence to it. And as healthcare clinicians, I think we need to make sure that we discuss this and it's part of our routine care. And as a woman, we need to remember that caring for ourselves enables us to also take better care of others. So, small, consistent steps, whether it's walking, lifting, or simply even choosing whole foods into your diet, will truly make a change.
Wonderful. It's a great message to wrap up on. I definitely like the
Yeah,
theme of finding what works for you and sticking with it.
exactly.
Awesome. Well, thanks so much, Jasmine, for coming on today. It's always great to hear your insights and your research in this area. And I wish everybody a happy National Women's Health and Fitness Day.
Yeah, thank you for having me again.